Hello, everyone. A very good morning and welcome to yet another AM MedTalk series. I am very excited that we've been doing these series back to back and we've been getting a very good response. So, thank you everyone for joining us, for being with us on these live sessions. And it's great to know that there is a lot that you are taking away from this live. So today the guest joining us is Annalouise. I can see she's already joined us, so I'm quickly going to add her into the live. Um, with Diwali being round the corner and with the festive times, with the bridal season, I don't think aesthetic medicine practitioners can get busier than what they get during these times. And of course, it's great to know and see how the industry has been only booming and growing with more demand for aesthetic medicine treatments. Like I always mention, I hope you all have downloaded your edition of the Aesthetic Medicine magazine. Hi, Anna. Good morning.
Hi, how are you?
I'm doing great. How are you doing?
Good.
And okay, so everyone who's joined us on this live, this is Annalouise Kenny. She's the founder and educator of Skin Philosophy Training. I think these days she's in Mumbai with us, and otherwise she hails from the UK as well because she has a clinic set up over there. And the good news that we bring out here is that very recently she launched her clinic in Mumbai. So it's a clinic and a training center. It's called Skin Philosophy Training, right, Anna?
Yeah, exactly. Yeah, just launched last week.
So, congratulations. I think this is big for you and just the right time for you to come into the India market. I was just mentioning before you joined that this is such a busy time in India with the festivals and the bridal season as well.
Yeah, it's very busy, even for just opening and, just getting into the market. Like the whole industry is crazy busy. The streets are busy, the shops are busy, everything is crazy right now.
Absolutely. So today Anna and I are here to discuss polynucleotides. We're going to talk about how you can revive your patients with polynucleotides. But before I go to my set of questions on this, I am very excited to first talk to Anna about her clinic very briefly and to understand that what inspired her to bring her expertise from the UK to India and the response that she has received in this last 1 week. So, Anna, having a setup in UK and the UK market is very different from the India market. So, what inspired you to bring your expertise from the UK to India and start your clinic here?
So sorry, my internet has been a bit dodgy, so I just have to move around a little
Yes.
bit. So basically, 2 years ago, I came over because I had seen that there was obviously the economy was growing, aesthetics was huge, and my point of view was always the education side. So I have the 9 schools in the UK. So more coming from an education point of view of, what are the courses like here? Who are teaching them? Is there much available? And 2 years ago, like a lot has changed even in the last 2 years, but in 2 years ago there wasn't really anything at all. And so now it's grown massively again, changed in the last 2 years. So then when I found the clinic in Mumbai, the location of where we are and Lincoln Road made perfect sense for it to be a clinic as well. And it's nice to get back into treatments for myself as well.
That's true. How has the response been so far? I know it's 1 week to the clinic in Mumbai, but what was the response you received?
Really nice, to be honest. Like even from the very start, with everything, people in India, it's been like very supportive, very encouraging. I've been delighted with how people have responded, how people like love the feedback of the treatments, how people love the feedback of the advice they're given. It's just a few little things that are a little bit different that they're appreciating. So far so good.
And do you find a difference between, the client needs in India vis-a-vis what you have experienced in the UK?
Do you know what? Probably the biggest thing is the actual, the needs are definitely different. So in the UK, in London, for a good few years, it really was skin rejuvenation, as in anti-aging, looking younger, getting rid of lines, all of that. In India, that's less of concern because of the oils and sweats and water that you create in your skin, you don't create, and because your skin is a little bit more protected than from the sun, it means that you get less aging. So that's less of a priority, but pigmentation is obviously a priority here. So it definitely is contrasting, definitely.
Right, right. And what is your vision for the new clinic here? Like any specific treatments that you plan to introduce for the, specifically for the India skin type over here, and your vision for this new clinic?
So basically, first of all, one of the main concepts is to keep it. It's You will have a lot of the same treatments, a lot of laser peels, needling, and all of that kind of stuff. So it's about blending the treatments and exactly how to adapt them, exactly suited to their needs. Having that knowledge about skin to be able to adapt it a little bit better. But then also it's kind of a little bit of working from within as well, because now we know that supplementation is so important. What we eat, everything contributes to our skin. So educating them, bringing that into the whole thing as well. So like lymphatic system detox, IV drips, all of the health from behind. That's what we're concerned about. So I want to bring both of those together, inside and outside, treating the client.
Right, right. Now, coming to our topic of today, which is reviving with polynucleotides. If you can begin with sharing what polynucleotides are and how they work with skin rejuvenation.
So basically, polynucleotides can come from salmon or trout. Now, they're very similar in DNA structure to us, and this is why they're very effective. So when we inject them into the skin, they stimulate fibroblasts to create new collagen, and they also have derma thickening. So like sometimes our dermis can get thin and flat, and it can also contribute to that, which very little things can do. And the clinical trial, the results have been massive. There's something like a 40% thickening over a couple of like 3 months. You'll notice a 40% thickening. It's mainly used around the eye area. I've had it done around the eye area. I've had it done once, and then I'll have another time when I go back to the UK. And that's has been so effective so far that I've seen like less lines, thicker skin, and that's just from one injection so far.
Hmm. Hmm. So, why do you think that polynucleotides have, in recent times become such a buzzword in aesthetics? And how do they compare with other skin rejuvenation treatments?
So basically, what we're starting to see with injectables is working a little bit deeper and longer. So if you take something like Botox, it's working with the muscle, and it's like 3 to 4 months. If you take something like skin boosters, it's more hydration to plump out the area, but that will eventually decrease. And ultimately, what we want to do with skin rejuvenation is stimulate collagen, and the fact that this will stimulate the collagen progressively over a period of time means much longer lasting results. Also, the dermal thickening is something that's very hard to do, that we don't get with many treatments, actual thickening of the dermis. So I think that's what's made it so successful. Plus the fact that salmon or trout DNA, because it's so similar to us, actually how well it works is showing really good results.
Hmm, hmm. And who would be an ideal candidate for, polynucleotide-based treatments? And are there any specific skin conditions that these treatments work most effectively on?
So basically, thin or darker skin around the eyes. So if you smile and you get like a crinkling around the eyes, or under the eye, directly under the like just underneath the eye, that area, if you're finding that's crinkling up, that's you should definitely get it done. Also, if you find you get a hollowing it or darkening of circle around the eyes, what it'll do, because of the dermal thickening, it means that our skin will sit less thin, which will be less see-through, which means the darkness won't be as dark. So dark circles and lines under the eyes are definitely the biggest.
I just smiled when you said that to check if I could make for candidate for this. But yeah, I don't know how dark my circles look on this live, and whether the lines are also showing. But yeah, maybe. Okay. So coming back to the questions and taking the focus off from myself. What does a typical polynucleotide treatment involve? So, if you can take us through the treatment and how soon can patients expect to see the results out of these?
So basically, now people are incorporating it a couple of different ways. So you can have your injections, which is like, kind of like your skin booster injections, very superficial injections around the area. Some people are incorporating serums that have polynucleotides in them and microneedling them to the skin, or electroporation, which is like using galvanic or antifreezes to kind of push the ingredients into the skin. The most effective will obviously be in the injections because you're going direct to that area. And so doing a minimum of 2 treatments and doing it about 3 months apart for the injections is best. If you're doing it for skin needling, then you would do it in a monthly effect, but that's more for overall rejuvenation of the full face rather than just specific under the eye treatment.
Right. And how long would these effects last on an average, like generally? I know sometimes it also differs patient to patient, but then
Yeah.
how long do they last?
So this is the beauty of any treatment that stimulates collagen. When you stimulate collagen, you're kind of like undoing. So then it's just gradually breaking down again. It's not like something like Botox where you relax the muscle and then 3 months later it comes back again, or like skin boosters where the hyaluronic acid eventually evaporates. It is stimulating collagen. So your natural aging will break it down. Some people will be quicker than others. It can be a year, it can be 2 years, it can be 6 months. It really depends on actually your diet and your stress levels, all of that impact your aging. And that's what we need to look after as well.
So, do you also recommend your clients to follow a specific diet when they undergo these kind of treatments?
So 2 big things is, one, if you're highly stressed, your results will be less and your results will be shorter lasting. If you're highly intake of sugar, your results will be less and your results will be shorter lasting. So if you want your results to be longer lasting, then taking these things into consideration, yes. And stuff like, say, for example, if you're treating lines, using a proper retinol between treatments will prolong the results. So it's simple things like that I find in India people aren't doing, the in between things that can help. Definitely, you like retinol is what's really important, and that will maintain the results in between.
Right, right. I mean, it's amazing to see how our stress levels and how the way we treat our body has so much impact on our skin. I think a lot of times there is a notion that, oh, if we're getting a treatment done, irrespective of the stress, irrespective of our
Yeah.
habits, the result is going to be evident. But I think this is where an aesthetic practitioner plays a very important role to make the client aware.
Exactly. Like I had a client once and we did a plasma treatment around the eye area. And so this plasma treatment is basically using plasma, which is kind of like evaporating through heat, getting rid of the skin off around the eyes. And the first treatment, the downtime was like 3 weeks and the
Mm.
results were so. The second treatment, the downtime was 10 days because she had cut sugar out of her diet. It had halved. The results had come quicker, they had lasted longer, and her skin had healed much quicker just because of sugar in her skin. And stress, 100%. Like my skin from trying to open this clinic for the last few months has been horrific. It's like it has a real impact on us.
Well, your skin still looks so beautiful. So then, if you are saying it has been horrific, I don't know what the beautiful side of it would be.
This is good lighting.
Yeah. Okay. So coming back to our whole focus on the subject, also that you did mention fillers, microneedling. So we often talk about, combination treatments as well. So does polynucleotides also complement other treatments like fillers and microneedlings? And how often would you recommend combination therapies for optimal results?
So like if you're it goes with the microneedling, kind of like exosomes. So you like needle it in for. So imagine you have a microneedling, and you can either put water into the skin to hydrate, or you can put collagen stimulants into the skin. So that's what you're doing. So doing that once every couple of months, like pushing that into the skin through microneedling, is amazing for your skin, because we can only get a certain amount through creams through our skin. So getting to do that all over your face is really important. It can be done with like all other things like ultrasound, but really I would stick to the microneedling or the injectables. If you want, like, say for example, say derma fillers can be used, say, around the whole face. You can sometimes do tear trough, but if you're worried about doing tear trough around the eyes, then you can do polynucleotides first. See if it works, see how well it works in you, and then decide if you want to do fillers later.
Hmm. 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 Um, can something go wrong in the whole process of treating with polynucleotides that an aesthetic practitioner should be aware of, and you can talk about it?
So polynucleotides, it's not as deep as like Botox or fillers. It's not as large a molecule as fillers. You don't have to worry so much. So it's more superficial. Of course, like, if you're injecting on an Indian skin, there's a chance of PIH because of the trauma. Like, there's always those little things, but there's nothing like serious at all.
Hmm. Hmm. With polynucleotides gaining popularity now, of course, we've already seen it very popular in the West, and
Yeah.
it's gaining popularity in India as well. Where do you see this treatment heading in the future? Do you think it could become a new standard in anti-aging protocols?
Yeah. So, like, if you remember 5, 10 years ago, fillers was very, okay, people weren't having it done. So something like this, I think it's actually going to develop a little bit more now. We've learned, how salmon DNA can really affect our skin. So I think the formulations, how it's done, will develop more. It's not going away, that's for sure.
We have a question from Aisha in the comments that are there any complications of polynucleotides, any arterial occlusion that we can
No,
expect?
because it's the same thing. Because what I was saying about occlusions will happen when there's like suppression on circulatory system, so when you're hitting a vein or something like that. So this is very, very, very thin molecules, very superficially put. So it's very easy to do the treatment and not have to worry about that as much. It's when fillers go deeper in, they're larger molecule, and then if they hit on a capillary or artery, that can cause the inclusion, because you're basically cutting off the circulation so that it's not able to like circulate. So then that's where your occlusion comes from. But that's the problem with derma fillers. Fillers are amazing. I've had loads of fillers, but you do have to be careful of the occlusions. Very, very
Right,
careful.
right.
Yeah.
So thank you for your question, Aisha. I hope you got that answered. And yes, this is the time for questions to come into the comments because we're reaching the towards the end of the live as well. So finally, Anna, what advice would you give to practitioners looking to introduce polynucleotides treatments in their practice?
So over here, what I would do very much so is look at the actual product. So what happens is something like this will come out. Everyone will jump on the bandwagon. They're going to get this from this. You need to see the results, the clinical trials. You need to really research of where they're getting it from, how they're sourcing it, and yeah, really do your research with the products, because it's still, there's only a couple of here, and that's where we're looking into, where we're trying to find the best ones with the best results, because there's no point in just saying we're going to do polynucleotides unless we know it's definitely going to give results.
Right, right. And any tips for patients who are considering this treatment for the first time?
um, I would say make sure that you know that it's definitely right for you if you're thinner or dark circles under your eyes, and make sure that the practitioner has been doing this already and knows about the product, and that you can also see the clinical trials and know where it's from. Be careful, because a practitioner will want to get the best, but they might not know what they're getting. So if you as a customer, you should be also checking that out as well to make sure that the product that you're getting injected is actual proper product and is, you know, regulatedly marked, clinical trials done, all of that kind of stuff.
Right. And I would also say make sure that you get a consultation from the skin philosophy training. I think that would be good for them as well. Yes, like Anna mentioned, she's recently launched it in India. It's at Mumbai Linking Road. So yeah, and Anna's very active on Instagram. So I'm sure if you have any questions for her or for us to ask her, you can just connect with us on our Instagram pages as well. So Anna, since you were speaking about, your suggestions for the practitioners, I know that you've not just opened a clinic, you've opened a training center as well over here. So what is the kind of training you are offering doctors and, they could look forward to? Like even you've given us so many advices and suggestions and recommendations or things to keep in mind for a treatment like polynucleotides. And there
Yeah.
are so many such treatments in the aesthetic world. Tell us a little more about your training center so that, doctors can benefit from it.
So basically, the training is what I found is what is needed most here is more advanced techniques. So we're going to organise talks from trainers that are coming from the UK to give that extra techniques, give that hand. That's with Botox and fillers. It's just enhancing. It's just because a lot here is you get your basic training from your suppliers and, you know, your bit of training about injecting Botox or injecting fillers, but it's really advanced techniques that an experience from people that is missing. So what we'll do is we're going to organise some of the international trainers to come over and do some talks as well.
Wow, nice. So if aesthetic medicine practitioners are interested in this, how do they connect with you?
Um, so basically you can call us or call into Lincoln Road or come on our website skinphilosophy.in or come on our Instagram. We're always on Instagram, we're always posting something or other. So yeah, it's good if you even want to follow to get an idea of what we're doing.
Wow. I think this is a great initiative, Anna, and at Aesthetic Medicine, we wish you all the very best. I'm sure this inroad into India is only going to do wonders to you.
Yeah, thank you
I'll
very
just
much.
take a last question before we sign off from the live. It's can you please tell us the difference between polynucleotides and exosomes? And a 4 needle is used to induce into the skin. It also is a 4 needle used to induce into the skin. And can we do polynucleotides after microneedling and CO2 laser? Oh my God, this is three questions in one. So let's go with the first. Can you please tell us the difference between polynucleotides and exosomes?
So exosomes had a big push into the industry because what it would do would it would replicate a cell. So say for example, if you had a fibroblast, it would replicate that fibroblast. So the potential of exosomes were huge. What we're finding is really where are these exosomes coming from? Are they being effective? Are they getting into the skin and are they replicating? So what happened was is kind of exosomes went massively popular and then completely fell off once polynucleotides came in, because polynucleotides, the two things of dermal thickening and the fact that it's the results that we've seen with it, it's showing a lot more rather than what we've gotten. It's very vague around exosomes at the moment, whereas polynucleotides, there's a lot more actual clinical trials and strengths with it. It's not about the actual exosomes, it's about how they're being made, where they're being sourced, and all that kind of stuff. So both are skin regeneration. Both can be done with needling or injectables. Both are like for plumping rejuvenation, but specifically polynucleotides are massively for around the eyes.
And is a 4 needle used to induce into the skin?
So this is where you actually need to talk to your supplier, because so every supplier, like say for example, some of the brands we use in the UK aren't even available here yet. I'm thinking of putting them into my suitcase and bringing them across. I probably shouldn't put that on the internet, but it's I'm joking.
Yes,
Um,
that
but
was important.
but so the thing is everyone will have a different way of doing things. Like even we had training with Obagi and DermaQuest this week. Now I've done training DermaQuest loads in the UK, and it's completely different how you're trained, what's been explained, everything. So it that really what how you inject and how you use your polynucleotides, it comes down to your supplier.
Hmm. And the last question was, can we do polynucleotides after microneedling and CO2 laser?
You can do polynucleotides with microneedling. With CO2 laser, it's amazing for because that's where it comes from is burns. It showed how it healed skin burns. So it's amazing for skin healing after skin burns. Again, you could use it instead of like needling in afterwards, is use it more as a serum and to help push it into the skin rather than actual injections on a specific area.
Dr. Aesthetic is asking if there are any side effects to polynucleotides and is it better than exosome? But I think, Anna, you've already answered this. Maybe they have just joined into the live. So no worries. I'm going to be saving this live. It's going to be visible on the Aesthetic Medicine India page, and it's also going to be visible on Annalouise Instagram page. So, Dr. Rebel Aesthetic, your questions have already been answered. Please go watch the live because I'm sure it's going to help you in a lot of ways, much more than just answering these questions. Having said that, thank you so much, Anna, for getting this Sunday out for us. I know
No.
you've had a very hectic week in India, and
Yeah.
yet you got this going. But like I said, all the very best.
Thank you.
And for everybody watching our live, this was Annalouise Kenny, the founder and educator of Skin Philosophy Training. And I'm Shriyal Setumadhavan, the editor of Aesthetic Medicine India. And Anna, are you going to be here for
Yeah.
Diwali?
Yes, yes, I can't wait. I even got my
Wow.
outfit and everything.
Super. Have you ever witnessed Diwali in India?
Yeah, no, 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 no. This is the first time. Can't wait.
Wow. So treat yourself this Diwali is all I can tell you. I'm sure you're going to have a
Yeah.
blast if you can bear the crackers sound
Yeah.
around you as well. But yes, we always say have a eco-friendly Diwali, and the crackers and the smoke and the pollution only affects our skin from an AMI point of view. So, having
Thank you.
said that, we will skip the AM Med Talk Live next week so that we all can be busy with the festivities and the celebrations. But on behalf of Aesthetic Medicine India, wishing you all a very happy and safe Diwali. And I will see you all soon next month with the AM Med Talk series. Thank you once again,
Thank you
Anna,
very
and have
much.
a great Sunday.
Thank you. You too. Bye bye. Bye bye.
Bye. Bye.